Any three of us, what we learned the last time?
Okay, sir.
Oh, yes,
I
sir.
I'm
Let's
the
have you.
yeah. Okay. I remember you said internal medicine is more related to the adults, where we are looking at the organs of these adults and see the diseases with these people and then help them. So that's what I remember about internal medicine relating to our course.
That's a good one there. Yes, any other? Or any other person? At least just three of you. I should have three of you. I'm okay. Yes, Mr. Evans Nyako.
Yes, sir.
Evans,
Yes, sir.
for
Good
you,
afternoon.
I know you very well. So,
Good afternoon, sir.
all right, let's hear you.
Yes, we consider the principles of medicine.
Okay,
Yes, and I remember evidence-based practice, usage,
okay,
research, clinical guidelines. Yeah.
okay. That's fine. That's fine. We
We
said
also
that.
look at holistic approach to medicine.
Okay,
Yes, yes, yes. That's when we consider the physiological and social factors in patient care.
okay. You are right. You are right. We said that. We said that.
And those the physicians who train in the internal medicine are called internists.
That's
We
right.
also
That's actually true. We said that. Yes. Any other? Any other? Yes. Any other?
Okay.
We
I also
also
remember. Okay. So please talk.
we also learned of family medicine,
Okay.
which is for the entire family.
Okay. Caring for the family as a whole.
Yes.
Taking care of the family as a whole. Okay.
Yeah, yes. You also shared about the principles of good medical practice,
Uh-huh. All right. Let's hear that one. What do you talk about?
yes, which include ethical conduct,
Okay.
communication skills,
Okay.
and someone help me out, please.
Clinical competence, patient
Patient-centered
care,
care. Yes.
uh,
Okay.
That's fine. That's fine.
Bedside
At least
manners,
Yes. Okay. Great.
that's good. That's
good
good.
bedside
That's good.
manners.
Yes. Olumide, Madam
she,
Olumide Oya Bolu.
she has
Is
spoke.
your hand up?
Yes, sir. No, no. I took down my hand. I had started.
Oh,
I had yes.
Okay. All right. So I'm looking for a particular file, but I can't find it. I don't know where I've placed it on my PC. But let's use a slide. I wanted to use a particular file that I've kept for you to explain something to you. But then let's use the slide. That's physiology. It's really hepatitis. All right. So the slide you have. Oh, So when we talk about the cardiovascular system, cardiovascular physiology, you want to know how the cardiovascular system is. You need to know basically the heart. You want to know how the cardiovascular system works. Now, when we talk about the cardiovascular system, we're talking about the heart, the composition of the cardiovascular system, the heart and the blood vessels. Okay, the heart and the blood vessels. So when somebody has a cardiovascular problem, it's the heart is affected or there's a problem with the blood vessels. You understand? Blood vessels. These two things form the cardiovascular system. So when there's a problem, it's either the heart has a problem or the blood vessels have a problem. Part of our studies, we are going to be learning both of them because the drug you give, most drugs that we give, either work on the blood vessel or work on the heart. And for us to say that somebody has a hypertensive or is hypertensive or has a cardiovascular problem, either of these is a problem. Okay. Yes. So looking. Okay. Is the image big enough for you to see?
Yes, please.
Yes.
All right. So pay attention. Go fast. So I'll go a bit fast, but you understand. So now let's look at the heart. If you look at the heart, this is how the human heart, a picture or a cross-sectional view of the heart. Okay. Now we have four main chambers of the heart. So we have one, the first one here, the right atrium. Then we have what? The right ventricle. And over here we have what? The left atrium, the left ventricle. You know this. These ones six signs, okay? Then we have two main valves. So one chamber leading to another chamber, there's what? There's going to be a valve. There's a valve, like a gate. So there's a gate here. Then from the left atrium to the right, from the left ventricle to the right, the left ventricle to the left atrium to the left ventricle. There's also another gate, which is what? The valve. Now we say valve are unidirectional. When we say unidirectional, they go in one direction. Okay, it's like a gate. How do you call it? Your house, the gate, your house. Now those gates, we have some that you can open just in one direction. You can't open it in two directions. You can't open it in and out. No. Now, for a normal gate, mostly normal gates, we have in and out opening. But valves, they are unidirectional. So all valves are unidirectional. So you realize that the tricuspid valve. So the valve on the right atrium that leads to the right ventricle is called a tricuspid valve. That of the left. Have you done anatomy of the heart? So that I'll go fast.
Yes, please.
No.
So you have done this one I'm
Yes.
talking about.
No.
Oh, okay, let's continue. I was about skipping it for you before.
Yes, you know, like did it. That's what I was saying. Yes.
That's what I'm saying. Even
Yeah,
see, you are doing the degree straight. Is that not it?
Yes, please.
So you're sure you have
I've
done
done
it for
an
you?
one and an activity two.
Okay. And they are now doing it, right? You are now doing it, right? So majority carry the vote. So let's go through it. So you're saying that the valves are what? Are unidirectional. So the tricuspid valves enters into the direction is entering into the right ventricle. That is for the tricuspid valve. Then one is also called the mitral valve or the bicuspid. Mitral or bicuspid. If you see, if the spellings are problematic for you, I can just put it here. We have tricuspid. You can see the chart section there. Tricuspid valve. I'll spell over there. Then we have the mitral or bicuspid. My people, don't let the big words worry you. Those are the names. Like you are called Zuzu, you are called Olumide, you are called your name. Those are names. So don't let the big words worry you. You also learn it along. Don't ask me what is the meaning of tricuspid. I don't know. That is their names. Ask you what is the meaning of appear. Well, you can't tell me the meaning of pit valve and mitral or bicuspid valve. So we say they are unidirectional. So you realize that I want to show you the past so that I'll show you how blood circulation occurs in the what? How blood circulation occurs in the heart. Now we're saying that then on the left side we have the left atrium or the left the left atrium entering into the what? The left ventricle. So the direction of the valve there is what? Is from the left into the left ventricle. You see that? So left atrium into the left ventricle, then that of the right atrium into the right ventricle. Do you get that?
Yes.
Yes. Now you see, you appreciate that this whole thing have what? Have how do you call it? Have directions. Now we have what we call the pulmonary. When you hear pulmonary, we are talking about the lungs. When you hear cardio, we are talking about the heart. So anything about pulmonary, P-U-L, pulmo. Are you seeing the chat side? Pulmonary valve. Pulmonary.
Yes, please.
Yes.
Pulmonary. Yes. So that at least you know what you're talking. Go down, you understand everything. This is the pulmonary. When we say pulmonary, we are talking about what? The heart. Sorry, the lungs. Pulmonary is about the lungs. Yes. Now, when we talk about how do you call it? When we talk about arteries and veins, now we're going to look at arteries and vein. An artery is a blood vessel. So these ones you are seeing here, they are just bigger arteries and bigger vessels. So all these ones that you are seeing here, they are just bigger. The aorta is a bigger artery that leaves the heart. It's an artery. All those you are seeing in blue colors are what? Are veins. And those you are seeing in the other color, the red and that of the yellow, are arteries. Okay? An artery takes blood away from the heart. When we say artery, A-R-T-E-R-Y, takes blood. It takes blood away from the heart. Bear in mind. So an artery transports blood away from the heart, and a vein carries blood to the heart. So the arteries will what? They are the what? They are the distributors. You understand? Let's say it's a factory that produces, let's say, mineral water. So the arteries are going to be the distributors. Now, the veins are going to be the Goro boys, those who pick the scraps and send them back. Do you understand what I'm saying? So the veins they pick up the blood that you have sent and bring them back to the factory. So let's do it this way. The arteries are like what? Are like the pure water distributors or the mineral water distributors. They will distribute it. The factory is the production site. That is the heart. Now, when we talk about the veins are the scrap dealers, those who pick the sachet waters and send them for recycling. Those are these. They are picking them back to the heart, back to the factory. I think you should understand with this one. So veins carry away from the heart. Sorry, arteries carry away from the heart, then the veins bring to the heart. Do you understand? So you are getting the piece. You've got to know that there are chambers of the heart. there are 4 main chambers of the heart. The valves are directional, so prevent blood from one point. So, for instance, the tricuspid valve here, it will open for blood to move from the right atrium into the right ventricle, but the blood in the right ventricle cannot go back to the right atrium. So they cannot take blood back to the unit. It can't go back again, same as the one here. Now, when you say, now we're saying that, let's look at, now you've seen all the part. This is the aorta. The aorta, you see, it carries blood from the ventricle, from the left ventricle to all parts of the body. Now, let's see. So this is how the circulation process takes place. So, okay, let's read. All the valves are unidirectional, which depends on the time difference across them. Therefore, the direction of flow is from the atrium to ventricle and to artery. Take note over here. You say what? The direction of flow is what? From the atrium to the ventricle. Sorry, from the direction of flow is from the atrium to the ventricle and to artery. Which arteries? We are saying that the blood comes from away from the heart towards the what? The lungs. That is the pulmonary. Okay, it takes the blood from the heart and send it to the what? To the what? To the lungs. And what does it go to do at the lungs? The lungs is full of what? Oxygen. The lungs is where gaseous exchange occurs. So the blood going there is not going to do anything. No. It's only going to pick up what? Oxygen. So that the oxygen can be transported to all parts of the body. Now, when the pulmonary artery goes to the heart, goes to the lungs, it doesn't bring it back. The pulmonary vein will have to bring it back. Do you see it? So this is the pulmonary vein. So artery will take away from the heart, but the vein will have to bring it back to the heart. And now when it's coming back to the heart, it will come through the what? Through the left atrium. Bear in mind, the blood was from the right atrium. Then it went into the what? The right ventricle. You understand? When it got to the right ventricle, it has to go, because all the blood here are what? Are blood that are coming from what? All the blood here are the what? They are that have to be recycled. So they are all coming from what? From consumers. They have gone to be used. Oxygen has been used. The content has been used. So they are coming back for a refill. Do you understand? So all these blood here are coming back for a refill. So when it gets here, when it gets to the right ventricle, it has to go through the right pulmonary towards the what? Towards the lungs, and go and pick up oxygen. When they pick up, this same vessel will not bring it back. You have to come by what? By the pulmonary vein, and come and enter the what? The left atrium. Now the left atrium will not have it much to do but to leave it for the left ventricle. Okay, and this is where the pumping activity, this is where a lot of contractility occurs, because this is the last point where the blood has been oxygenated and has to be pumped to all parts of the body. So the left ventricle here will pump the blood through this main artery, which is called the aorta. That is the biggest artery, the largest artery, the biggest artery, to all parts of the body. So you see, it's giving out several directions. Some are going to the brain, some are going to the what? To the lower, some are going to the what? The bigger veins. Yeah, the bigger how do you call it? Vessels. So you realize that, and what do you see here? You realize that this part of the heart, the body, this part of the heart, the body of the heart, You see that here has more flesh. It is adapted for that. It is done that way because that one. Okay. So let me do it this way. Are you able to see it?
Yes, please.
Yes, yes,
Can you see the heart? The heart.
Yes,
yes.
sir, we
Wonderful.
can.
Yes,
So
because
all about this is how it's going. It occurs in seconds. So you realize that the blue is from outside here, enters the valve will open. This they are all occurring at the same time. Valve will open, then the blood will leave the right ventricle into the what? Into the pulmonary artery. Then it sends it to the lungs. Now the same blood is coming back. So it's a continuous something. The one that went, another one is coming. You understand? It's like a chain. Some are going and some are coming. Some are going. That is why there is proper circulation everywhere. Because if they stop, if the heart stop beating, a lot of things is going to happen. So this is how it happens. This is how it looks like. Yeah. Is greater than ventricular pressure. Now we are talking about the physiology. We are saying that how will blood leave the atrium into the ventricle? It is when the pressure inside the atrium, when the pressure here. So I want to end this thing. So when the pressure inside the atrium, when the pressure inside the right atrium is what? Is when artery pressure is lower. No, it's not this one. So when atrial pressure is greater than ventricular pressure, the atrioventricular valve, also known as the what? The ventricular valve, is pushed open and flow proceeds from the atrium to the ventricle. You understand? Either the bicuspid or the tricuspid, they are called atrioventricular. Means the atria and the ventricular valve. When the pressure on top is higher, it will push the valve so that the blood or what will move from the top to the down. Do you understand? That is it. Now, that is it on both sides. Okay, because all of them, atrial blood moves into the ventricle. Now, ventricular blood moves into the what? Into the artery. Okay, then let's. When artery pressure is lower than ventricular pressure, the pulmonary aortic valves are pushed open and blood flows into the arteries. So we are saying that when the arteries, so we are talking about how it happens, or how it's occurring. We have got to know that when the pressure in the atrium is higher, it will push the blood down into the ventricle. Now, when there's a lot of pressure in the ventricles, it is going to press the artery over here. The pressure in this one, when the pressure in the ventricles, either the left ventricle or the right ventricle, it will push and open this valve. So the higher the pressure, the pressure there pushes it to for the valves to open. When there was a pressure here, it pushed the valve and the valve opened and the blood came here. Now there's a lot of here. So push this one for this one to also open for the blood to leave. This one, the pressure here, the valve here to open. Then to enter here. Now the blood to the left ventricle side. And we call LVF, ventricular hypertrophy. It's heart failure. It's part of the, we will learn heart failure. So we'll learn about left ventricular heart failure, right ventricular heart failure, or continuous heart failure. But in the context, a lot of contract, most comes okay, and hypertrophy. The left ventricle has what? Has enlarged. Okay, has enlarged in size because of what? Because of the activity, because of the pressure on it. It expands a lot. Yeah. So do we understand? Do we understand the way the heart works now? So blood leaves the pulmonary artery and goes to what? Go pick up.
Your voice is gone.
Any question? Is there any question? Is there any question?
Let's continue.
So the reverse of what? Of the blood. And that one too is very dangerous. Naturally, it has been made that it should move from one direction to the other. It shouldn't go back. So if you have a condition we call the valvular heart disease and the blood is moving back, there's a problem. You understand? Yeah. So you see, this is what? This one is the aorta. It's the biggest artery of the heart. You see this big thing. Now, the one that is feeding the aorta is the what? Is the left ventricle. Is the left ventricle. You understand? The one that is feeding the aorta is the left ventricle. So if there's a problem with the left ventricle, then it becomes a problem. It becomes a serious problem that we will have to, care about. Madam Olumide, let's hear you.
Doc, I've heard of the enlarged heart. What condition is happening? What is happening when we say that there's an enlarged heart?
Okay, so when we say there's an enlarged heart, mainly most of the time is at the left side. We are saying that mostly an enlarged heart in a medical term we call it cardiomegaly. When you say cardiomegaly, okay, cardiomegaly. So when they say cardiomegaly, we are saying that, you see, that's what I'm saying, that you are. I'm making you know what they all do. Most of the blood that come here, the one here, the left ventricle is the one that pumps to the aorta. And you realize that most of the pumping activity of the heart, majority of the pumping activity of the heart occurs at the what? At the left ventricle. Because that one is what pumps to all parts of the body. These ones are just receiving. This one is receiving. This one, it pumps to the aorta. So any small amount to receive, it pumps. But over here, it is pumping to all parts of the body. And bear in mind, the demand of the body is higher. The heart becomes we get a enlarged heart when the muscles here, because of the contractility, because of the contraction and relaxing to pump blood, the muscles here get what? Enlarged. They becomes wider. It's like this. Let's say the muscle here is like a rubber. Okay, it's like a rubber, and you are every time you are pressing and relaxing. You are pressing and relaxing. It is pressing and relaxing that way. At the point that it becomes very weak, or it becomes wider. You understand? It's like a balloon. You see how small balloon is. If you begin to pump blood into it, push air into it, at the point it doesn't. When it's how do you call it? When the air comes out of it, when it deflates, you don't get the same size balloon. Do you believe that? When you blow air into a balloon, you tighten it, then you deflate the air, you don't get the same size. As you continue and continue and continue, this small balloon becomes a very bigger balloon, even when it is deflated. That is how come we say there's an enlarged heart. The heart continues to contract and relax, contract and relax, contract and relax. That is why if you have hypertension and your heart is beating too fast, in a long time, you tend to get what? Enlarged heart. You understand? When this enlarged heart can lead to what? Heart failure. The heart will fail because the heart is pumping and working, pumping and working, pumping and working. And the very part that is doing the job are the ventricles. Because the arteries are only receiving, and when there's pressure, it will open the valve, then it gets into the ventricle. Now, the right ventricle and the what? And the left ventricle are where the lot of work takes place. And most especially, the left ventricle takes a lot of the pressure. Why? Because one, with the right ventricle, Oh, my voice is on and off. You can't hear me.
We can hear
Yeah,
you.
we can
Can
hear
hear
you.
you.
Someone
Doctor.
just typed. Voice is on and
No,
off. Madam
it's not.
Christiana, are you? Let me finish and ask your question. So we're saying that the right ventricle and the left ventricle, they are playing serious roles. Why? Because they are the pumping. They do a lot of the pumping activity. The right ventricle will pump to the lungs, and the left ventricle will pump to all parts of the body. So, which one is going to have a lot of pressure? One is pumping to just the lungs, and one is pumping to all parts of the body.
Is the left.
The
The left,
legs.
we pump it to all
If you
parts.
can look at the picture very well, you realize that the muscle around the left it has a huge muscle. The muscle, even the picture is showing that the muscle is huge, and that is why you see it's tilted towards the. If you look at the picture, it is tilted towards the left side. When you are looking at it, when you are, as the patient's right, the patient's right is your left. Your right is the patient's left. So the slide you are looking, it is tilted towards the right, but that is the patient's left side. So you realize that the heart is more towards the left side. The contractility or the how do you call it? The pumping activity occurs majority at the heart, at the left ventricle. Do you understand? So if this left ventricle pumps a lot, this heart has been, maybe you have your heart is beating normal. Maybe when you go to around 40 years, you develop BP. Then the heart started to beat abnormal. You understand? The heart started to beat abnormal. It started to beat more than it should beat for about 10 years. This heart is likely to what? This heart is likely to what? To expand. The left side is likely to what?
Yeah.
Expand. You understand? I'm just looking, and I'm saying that let's use the balloon as an example. If you pump air into balloon, every now and then you are pumping. First one, you pump, you deflate, you pump, you deflate, you pump, you deflate. After about 10 pumps, 10 blowings and deflation, you wouldn't get the same size of the balloon as how it started. The muscles have what? Have contracted, have what? Have expanded. Do you understand? Madam Christiana, is your hand up?
Yes, please.
All right, let's hear it.
So, yes, so in a case of a hole in heart, how does it look like within the
hole in heart is a different. No, hole in heart is a different thing altogether. Yes. Okay. So when we say hole in heart, mostly hole in heart, we are talking about what? You see this one. You see the over here. Look at where my thing is pointing. There is a what? A muscle. There is as we call it, the septum. Is it the septum? Yes, the septum. It is separate. It is what? Blocking blood from the left ventricle, from the right ventricle, from entering into the left ventricle. You understand? You can blood from here cannot enter here. As a matter of fact, no blood can what? Can leave one point to the other without going through a valve. Do you understand what I'm saying? All blood, when a blood is leaving one point to another, it has to go through a valve. But there are situations whereby the valves are there all right. But then there's what? There's a break in the what? In the tissue. Let's say over here. There's a problem here. And so there has been a break over here, and blood is leaving here and can enter into this one. Do you understand?
Yes, please.
Not the valve, the septum. There's a problem in the septum, or there's a problem somewhere. Let me show you pictures. I mean, it's good to work with pictures. And those ones, they are what? They are congenital problems. That's what we call the congenital heart diseases. The tetralogy of Fallot. There are plenty. There are about 5 of them. I'm coming. So hole in heart, normally you realize that it is common in children, right? It's common in children, right?
Okay.
Doc, are you done answering my question?
That is if you answered.
Yeah, I'm answered, but I did not actually finish with my question.
Oh, so you have a follow-up
it-
question to that?
Not to this, but the previous one
No
regarding
problem.
the heart enlargement. So you've made us to understand that when the the muscles within the left ventricles are enlarged, that's when we can term it as what an enlarged heart.
Both of them
Now,
can be. Wait here. Both
Okay.
left and right can be enlarged.
Okay. My
Both left
question
and
is
right can be enlarged. Yes. Let's hear you.
okay. So my question is, that's the mainstream treatment, drugs that can actually get it back to normal, or even with the naturopathic treatment, are they drugs? Or has there been a case where it has been treated and then the muscles have contracted back to its normal state? Thank you.
Okay, that's fine. That's a very nice question, and I'll give you a very nice answer. Okay, so right now we need to know how did the contractility, no, how did the enlargement occur? You understand? How did the enlargement occur? It was because the heart was what? If the heart were to be pumping normal, there was not going to be any enlargement, right? If the heart was pumping normal within normal range, there was no hypertension, there's no pulse rate above the normal. There was not going to be any contract. There was not going to be any what enlargement. The heart was going to work normal. So the drugs that we will give are drugs that are going to stop that what that contractility effect. Because there is the excess contractility that is making the heart what enlarge. Nobody is holding the heart to pull it. You understand? The heart is very normal, but then because of what the excess contractility, it expands and relaxes, expanding and relaxing, it expands and relaxes. Then it has become enlarged. So what do? If we are giving drugs, that will stop the what? The expansion and the relaxation of the heart, the excessive expansion and relaxation of the heart, so that the heart can work normal. And if that one occurs for a very long time, it takes its shape back. Unless it has gone beyond normal and has become so defective and cannot go back. You understand?
Hello, Doc.
Yes. Are you answered?
Yes, please, Doc. Thank you so much.
You're welcome. I'm sure the answer is a very nice one, like I said.
It is. Thank you.
Yeah. So
Hello,
the
Doc.
drugs you give are just tailored towards the problem. So yes, my brother. Let's hear you.
Yeah, thank you very much. I think this is why naturopathy is very interesting.
Okay.
Some will come to you from the orthodox side, and if you even check their BP and they are hypertensive, you ask them the cause. What did they tell you is the cause of your hypertension? And they will tell you they didn't tell me anything.
Yeah, they don't know.
All that they did is they checked my BP and said it is high. So I should go for medication and then come back for review. But with naturopathy, just as you said, we will have to deal with the cause. So as naturopaths, we don't have to just listen to the person and then give treatment, than to go further asking questions to know the cause. So like you said, it's just like cause and effects. Or those of us with the computer will say garbage in, garbage out. So as far as you get to know why the problem occurred and you are able to tackle it, it could be reversed as well. So thank you for the answer given.
Yeah, can you see my slide?
Yes, please.
What are you seeing?
I can see when arterial pressure is lower than
No, not
ventricular,
that.
not this very one.
I'm coming.
Okay.
I want to present something else for you guys to see. Oh, Ingrid, your hands are up. Oh, sorry. Okay, Madam Eunice, let me take it. I think, Madam Eunice, let's hear you. Eunice Tony.
Yeah. Yes, please. Please, in your presentation, you were saying that with the left ventricle, because it expands and contracts a lot, there is always pressure, and sometimes it gets hypertrophied. And so when that happens, usually
Right.
so I wanted to ask that in the hospital, is that the reason why usually when people get left ventricular heart disease, they have to give them blood, maybe because we don't want the patient to get maybe when there's a backflow of blood, there can be mixing of oxygenated and deoxygenated blood. Is that why they put them on oxygen, they transfuse them with blood?
Okay, so that one there, I don't know how to even say it. There are multiple factors when it comes to that. Okay, when it comes to that, there are multiple factors. So we will give blood to someone who has a heart problem when there is an indication for the blood. Maybe the person has a high output heart failure, the person is anemic, we give blood. If the person's heart failure is from the fact that the DPs are high, we give hypertensive drugs. Now we'll give oxygen when there is what? Mostly when there is how do you call it? Heart failure. Yes, the heart is failing. Now, what does the heart do? The heart pumps blood to all parts of the body. Now, there's a problem with the heart. The heart is not able to perform its function very well because the part that has to contract, the left ventricle that has to pump the blood to all parts of the body now is weak, so it can't pump a lot. It will just pump something small. So it means that the extremities there's oxygen deficit.
Okay.
Do you understand? In the body. So we just
So
support them
sorry,
with oxygen.
yeah. So if I may ask, so with the left ventricle, you said earlier on that it's it transport blood to the pulmonary, what is it, artery to the vein.
The left ventricle.
Yes.
So the right is the one that sends to the right sends to the pulmonary artery, then it goes to the lungs. Then the then the pulmonary vein picks it from the lungs and bring it to the what? To the left atrium. Now the left atrium will open way into the left ventricle. When it gets to the left ventricle, we'll have to pump it into the aorta to all parts of the body.
Yes. Okay.
What I said, do you understand? Sorry.
Yeah. So it means during the blood circulation in this area, it carries oxygen. The blood.
Yeah. So why does the blood go to the lungs?
For oxygen.
Exactly. So the work of the right ventricle and the pulmonary artery is they are all transporting the blood for it to be oxygenated in the lungs.
Okay.
And it will be brought back again to the heart for pumping to occur.
All right. Thank you.
Do you understand?
Yes, please.
So you need to understand it very well.
Yeah.
Oh, I want to share something. That's why I'm worrying myself. This thing is worrying me. I'm coming. I wanted to share the hole in heart something for you to see. Oh. Give me some few minutes. Let me use this one to share. Okay, so let me share. All right, Madam Ingrid, let's hear you.
Yes, thank you, thank you, Prof, for a very, very informative presentation. So I wanted to ask, is it, you had mentioned before that the Holy Heart was more prevalent in children. Is it that by the time you're adult, the condition is fixed or attended to?
I can hardly hear her.
Can you hear me any better?
Yeah, come again, come again.
Okay, I was asking about the prevalence of Holy Heart more in children. I was wondering, is it because that by the time they reach adulthood, the problem is addressed, or is it something that can occur or start when you're older than a child?
Oh no, you see the genetic, the Holy Heart is congenital, meaning it starts from birth. I mean, it's from birth. It's about the forming. It's about the. It's a defect
In the development.
Yeah,
Okay.
it's a defect. Let me put it that way.
Okay.
When we say a
Okay.
defect, it means that it wasn't formed very well, or that part didn't form. So there has
Yes.
been a problem there. There's a gap there. You understand?
Yes.
Can you
Yes.
see my
Okay.
slide? So as they grow up, so there are surgeries they do for that. They have medical equipment that they use for those things. There are
Okay.
surgeries they do for that. So I want a clear one for you to see. I don't know if you can see this one. Can you see my slide?
Yes.
I
can pinch it out.
Pardon me?
You can use your finger and pinch it out. Like I can pinch it out.
Oh, okay. I'm coming. So can you see?
Yes. Oh, yes.
You see the difference?
Yes. Yes.
Who asked the question?
Please,
Well, I asked about heart.
Yeah, so this is a congenital heart disease, a hole in the heart. So you see it?
Yes.
So now what will happen here? Blood will leave the right ventricle and enter the left ventricle. Blood that is, and bear in mind, the blood in the right ventricle is not oxygenated. Do you understand?
Right.
So when it enters the left ventricle, what will happen to the left ventricle? The left ventricle will pump unoxygenated blood.
Yes.
Is that clear?
Yes, please.
Yeah. So that is Holy Heart. That is Holy Heart for you. Look at the one here too. The right atrium. Have you seen that?
Yes.
Can you see my cursor?
Yes.
Yeah. So you realize that there's a hole here and there's a hole here. So Holy Heart children, most of them, they normally look they look cyanosed, they look blue. Some of them they present as blue. They will die early. Some of them if it's not happening, they tend to lose their lives. Why? Because what is happening here is that blood will leave a deoxygenated blood, a blood that does not contain oxygen, will leave here and enter here. And then when it enters here, there is pressure here, so it will pump it. It means that the blood that came from the body is the same blood that is going. No oxygen. Can this person survive?
No.
No.
Same as this one. Same as this one. You see, blood that is what? That is from the blood that just came from the what? That just came from the from the body. That is from the right atrium. Entered the what? Entered the what? The left ventricle. So when blood enters the left ventricle, what happens? The left ventricle what? We also see there will be pressure here. then it will release it down here. If the pressure is here, it will release it down here. You understand? When it releases down here, what will happen? It will pump it. So it means that there's going to be what? A pump of what? Deoxygenated blood or unoxygenated blood. And that is also very deadly to the body. You understand? So hole in heart is a congenital problem when there is what? There is a malformation, improper formation of what? Of the bodies of the heart. There are several of them. Some of them is even about the what? The body. Some of them is about the vessels. But this one it looks like more of the septums. You understand? There are about 5 of them. So we can read about them. Congenital heart diseases. We call them the congenital heart disease. Hole in the heart. All right. So that was a very nice question. It has made us learn something. Mr. Champon Eric.
Okay. My question is, what will cause ventricle low pressure and high pressure on the?
Can you hear him?
No.
Hello.
Please come again.
Yes, my brother. I'm listening.
Please, I'm asking that what will cause low pressure in the vertical?
Okay. Your question were in 2 folds.
Yes, and the second one was high pressure in the artery.
Okay. So, like I was saying, you said what will cause low pressure in the ventricles and what will cause high pressure in the arteries? That's a very nice question. So, when there's low pressure here in the ventricles, it is because there is not proper filling. When the venous returns are low, when the blood that is coming from here into the ventricle, the blood that is coming from here into here is what? Is low. Meaning that there's going to be low pressure here. So if there's low pressure here, and bear in mind, the ventricles only act when there is pressure. So when the blood here is enough or is a lot for them, then the pressure will make the valve open. You see, the pressure here will make the valve open. Do you understand?
Yes, sir.
Yes. So when there is what causes low pressure is when there is what? Not improper filling or there is low venous return. And there are conditions that causes low venous return. We'll get to learn about them. But I'm just answering your question that what will cause a low pressure in the ventricles? When there is low pressure, it means that a lot of blood is not coming. So there's low pressure here. And so it can also what? Can also not pump it. And that can also become a problem. Likewise over here. When there's a low pressure, it means that there's what? There's a problem at the lungs region. So here, the venous return that has to come into the left ventricle to be brought here, there's a problem. So there's what? There's low pressure. It has given a low pressure in the ventricle. And the ventricles also pump when there is pressure. They pump against pressure. You understand? When there's pressure, then they move against the pressure. Because bear in mind, over here, it has to fill it has to fill very well. Because the vessel here is a very large vessel. So if you are pushing, if you have to push through a bigger vessel, means that you have to push a lot so that it can go. When you push through, it will not go. The thing is, the vessel is wide. If the vessel was tiny, you don't have to worry. You push small and it runs away. But then imagine you are pushing water, or you have a sachet water in your hand, and you are pushing it through what? Through a tube, and pushing that same sachet water through a barrel. Do you see the difference? If you are pushing sachet water through a tube, you would see that there's going to be a lot of pressure, and so the water can get to the end of the tube. But let's say you are pushing that same water through a barrel. It wouldn't go anywhere. You understand? So it means that you have to pour more water through the barrel so that you can have the water at the end of the barrel. I don't know if you understand my analogy.
Yeah, I understand.
You understand?
Yes, sir.
Yes, sir. We understand.
Yeah. I just
Yes,
want
sir.
to.
We understand.
I'm just going slow for you to understand. I mean, this topic, I don't know when I learned it, this thing, it was just one lecture. But I can't take one lecture for you. It was just one lecture, and the lecture is gone. You understand? But I mean, I just want to take my time for you to understand. You understand? So that is it. That is how the whole thing works. Mr. Samuel, is your hand up?
Yes, sir.
Let's have you.
So, I wanted to ask, in a layman context, how you explain the relationship between the heart and the lungs? Because when someone is suffering from heart diseases, he is mostly affected by his breath or oxygen. Let me give you a scenario. As I'm sitting here, my respiratory system or my lungs aids my breath. But if the very person is affected by the heart, or he or she has a heart problem, you see the major symptom the person will exhibit is his breath. So what is the relationship between the heart and the lungs in a layman context?
That's a very brilliant question, my brother. Charlie, big ups. Let me give you thumbs up. Your question has even moved me to think more. But then it's so simple. Okay. I mean, for me, I always believe that there's simplicity in everything. Why do you think that when somebody has a heart problem, your question is when somebody has a heart problem, is the heart that is affected, but then the person is having problem with the breathing.
So what is the relationship?
But then the person is having problem with the breathing, right?
Yes.
Yes. The reason being is that we have from this one, you should be able to even explain to me why the person is having that. Because all the blood that are from the heart will have to go and visit the lungs before they can be pumped to all parts of the body.
Yes,
Now,
so the question was from a layman context. So if you go further, not in a science point of view.
Oh no, like let's I'm just explaining to you. So you just listen. I'm going Leo. If I'm going science, that one I will have used
yes, I understand.
Stroke volume and ejection fraction and those things. So this is a layman's one. So if it's not layman for you, then I don't know what I can say again. But let's go. When we talk about, oh my goodness, when you look at the heart and the lungs, what happens is that every blood that has to be pumped out from the heart will have to go to the lungs to go and pick oxygen before it can be pumped. Now the heart has a problem. Do you understand? Then the heart has a problem. So the heart is not able to contract, relax, and do that pumping effect.
Okay.
Again, the heart is not able to, if the heart is at fault, let's say the person has left ventricular hypertrophy.
Okay.
The person has left ventricular, the left side is enlarged. So what will happen is that now the blood will come, he's not able to pump a lot out.
Okay.
So if he's not able to pump a lot out, a lot will not come for that lot to go to the heart to go and pick the oxygen and bring for it to pump again.
Okay.
So the problem is at the heart, all right, but then the heart has to go to the lungs to pick the oxygen. Now the amount, and bear in mind, the amount of blood that goes there is that amount of blood that picks the what? That picks the oxygen.
Okay.
You understand?
Okay.
So if you pump 2 mils, if 2 mils go to the heart, to the lungs, if 2 mils of blood goes to the lungs to go and pick oxygen, it means that 2 mils of oxygen is coming to the what? To the heart, for the heart to pump to all parts of the body. And ask yourself, is your breath 2 mils? Do you understand?
Yes, sir.
So it means that the heart has a problem, all right, but then the heart has to go to the lungs to go and pick the oxygen. Maybe the lungs might be fine, but because the heart has to go there, has to pump there, Maybe the problem is at the what? It's at the right ventricle. Maybe the person, there's a case we call, also we have what we call biventricular heart failure. It affects the right and the left as well. Biventricular heart failure. So let's say the right ventricle has a problem. And the right ventricle is the one that has to go to the lungs to go and pick the what? To go and pick the oxygen. Now it is going to pick 2% oxygen. So if you bring that 2% oxygen to your left ventricle also pump 2% oxygen to the body. And now the body cells what? Will be needing oxygen. And that is when we call a condition we call what? Heart failure. We will learn about heart failure. Heart failure is what? Is when the body is not able to pump enough blood containing oxygen to all parts of the body to meet the what? The metabolic needs of the body. Every metabolic activity of the body involves what? Oxygen. We'll learn about Krebs cycle and learn about glycolysis. You understand? In biochemistry. So it's good I'm handling you for the two courses so that we can know. I mean, I'll know that I've taught you. You can't tell me that you don't know. Yeah. So that is how it is. I don't know if I've answered your question, but I think I've answered your question.
Okay, so per my understanding, the oxygenated blood or the blood with the oxygen. Please, I get
Okay,
it.
yeah,
The
listen,
blood
I'm
with
listening.
oxygen aids in breathing.
Pardon me, come again. You said something.
I said, so the blood, now you mean the oxygenated blood aids in oxygen. That is why if a patient is suffering from heart problem, he or she may suffer from the first thing, the major thing he will suffer is his breathing.
Exactly.
Please, that was what I want to say. Okay.
Exactly. Because the reason being is that the breathing you are seeing, yes, you can see that how do you call it? What if the person is in respiratory distress? It doesn't necessarily mean that the breathing is there's a problem at the lungs. The body cells need oxygen. They are not getting it, so they have stimulated the brain, and the brain has stimulated the what? The lungs, because that is where you are the what? You are the one giving us oxygen. The cells need oxygen. The brain, the organs, the liver, the kidneys, they need oxygen. Their cells need oxygen to function. Now you, the liver, you are the one producing the oxygen, and you are not bringing the oxygen enough. So the brains are stimulated. They stimulate the heart. The heart also goes to stimulate the what? The lungs. But now, right now, the problem is what? Is at the heart. The heart has a problem. You understand?
Okay. Yeah.
Yeah. So that is it. So,
I actually asked because I had a patient which was interested in this, so he asked, and then he actually prompted me to go and then
so
refer.
now you have a better understanding for him, right?
Yes, a better one.
That's a very good one. So it's good you know the anatomy of how the heart, the cardiovascular physiology is, or how the heart functions. You understand? We will learn something about stroke volume and ejection fraction. That one I think I should teach you. I wanted to skip, but I think I should teach you so that you also appreciate it. This part is about the. So I think I can take this slide off. Any other question? Is it Kadish?
So I have a question.
Is it Mr. Who is talking?
William David.
No, let's pick Kadish first. Kadish is the one on the line.
All right, okay.
Kadish.
Yes. Greetings.
Madam
Thank you.
Kadish.
Greetings, everyone. Thank you.
Yeah.
Yes, I'm really enjoying the class and I'm learning a lot. Of course, in a lot of things also. So based on the pumping that we have been talking about, strong pumping or low pumping, which leads to lower high pressure, that would indicate the pulse, affecting the pulse rate of the heart, right?
Yes.
But my question really is for a person, sometimes you hear their heart is working at a percentage rate of about 30. And then, they say, okay, they have to do an open heart surgery. They might have to do like multiple stent replacement to help with the functioning of the heart. But you said we were going to do heart failure. So should I wait until that topic, or can you just touch a little on that?
You can ask your question. Don't worry. You can ask your question.
Yes, for the person going through a 30% heart, functioning, what really is happening in the heart for it to be functioning like that? I know some of it could be due to blockages, but can you explain the whole anatomy of it?
Yeah. So it's simple. It's not so big for you to, understand. From what we have talked over here. Now, what's happening is that this part. Let me show you a picture. I love pictures. Can you see this? Can you see my slide?
Yes.
What do you see? What do you see?
Okay. So 2 hearts.
Okay, that's fine. It means I'm the right spot. So you will see 2 hearts, right? So you see the one on the left side and the one on the right side, right?
Yes.
Now, for the one on the right side, you realize that see the muscle over here. You see the muscle
It's
over here?
very thick, yes.
Very thick. Oh, what are we within there? Hypertrophy. All the muscles there. This is the normal one. You see how first it looks like. Originally, this place is thicker than this place, than the right side. You understand? Normal. But then over here, you realize that this one is more enlarged. You see this area? You understand? So what will happen over here is that you realize that this part is weak. It's weak. It's weak. You understand? It's weak. So what will happen is that it will not be able to function as it will function. So there are some surgeries that they will do. They will say that the heart is working at 30% or this one. That one, it can be, and bear in mind, if it happens like this too, it also affects the electrical activity of the heart. That is where the pacemaker also comes in, and the SA node and the AV nodes. That is where they also come in. You understand? Now, we are talking about the contractility of the heart. Now we are saying that, you see how this thing has enlarged and contracted and relaxed, contracted and relaxed. Once away, it has stretched. It has stretched. You will see that it looks like there has been an addition of the muscle. No, there's no addition. It's the same muscle, but this one is what? This one is well contracted, well shaped in a normal form. But this one has what? Has relaxed. Has become like a balloon. It's the same muscle. Nothing has been added. Nothing. But it has just what? It has just expanded and has become weak. All these areas will not function again. So what we'll have to do? They will have to go and what? Do a surgery that can chop off all these areas. Do you understand? So that is why they say the heart is working at 30% capacity, 40% capacity. It's because of what? Of this thing. Because if it happens like that, all these areas, look at it, about the down part, I can say all the down areas of the left ventricle if there's blood, if the blood goes to like there, it will not contract. Why will it not contract? Which muscle, which force, which tensile strength is going to contract it? This has become weak like a sack. Do you understand? It has become very weak. It's weak. It's weak. So it can't contract. So it means that just the top part, obviously there's going to be what? Some force. So just small amount of the blood over here will push up. Plenty will be left below.
It can't even take a lot of volume.
Pardon me?
I said it can't even take a lot of volume. Volume of blood.
Exactly. No, the reason is it will take a lot. It will expand. It is expanding to take, but it can't pump a lot. So you will be left with a lot of the blood inside. There's going to be small ejection fraction. The amount of blood that leaves the left ventricle to all parts of the body. You understand?
Yes. So can smoking be a contributory factor to this?
Can what?
Smoking, cigarette, especially cigarette smoking.
Yeah. I mean, there are multiple factors to smoking is part, alcohol is part, lack of exercise is part, smoking there is part. Because what will smoking do? Smoking, what does it do? It contains, it takes away nitric oxide from the blood vessels, and also the heart muscles are also innervated. So smoking is one major problems of cardiovascular conditions. Yes, so smoking is also part. So do you understand that?
Can I ask my question now?
Have you been answered? The one who asked the question.
Thank you very much. Yes.
You're welcome. Eunice, do you have who said he has a question? Somebody said he has a question.
Good evening, everyone.
A question. Somebody said he has a question.
Good evening.
All right, Madam Eunice,
William Davis.
Oh no, Mr. Imano, sorry, Iman Diodu.
Good evening, everyone.
Is it Emma?
No, it's William.
Yes, sir.
Yes, Doc.
Good evening, Doc.
Yeah, let's hear you.
Thank you for giving me such opportunity to ask this question. Please, if someone is having a higher cholesterol, can it affect the heart?
Yes, it can. We'll get there. There's a condition we call atherosclerosis, where there's going to be there are plaques inside the what? Inside the blood vessels. Now I made you know that cardiovascular conditions occur when there's a problem with the heart, the cardio, and the vessels, vascular. So we say cardiovascular, heart and the blood vessels. Now, high cholesterol will cause lipids to line inside the blood vessel. So when there are lipids deposits inside the blood vessel, they are going to block the blood vessel. They can even block the vessels of the heart.
Okay.
You know, there are vessels of the heart, the coronary arteries, the coronary veins. So, if there's a plague or there's fat deposits inside. Let me show you a picture. I love pictures. I'm good at pictures. I love to. Yeah. So when you take a nice picture, you can send to me. I love to work pictures. Send me your picture when you are in your facility. You can send me a picture of you and your facility. Let me see. Where am I?
Yes, I was trying to.
You said?
Yes, I was trying to ask for the muscle of the heart to be hardened. Can cholesterol also cause that?
For the muscle of the heart to what?
and high in cholesterol. Yes, sir. What I'm saying is, for the muscle to become hard, the muscle of the heart to become hard or to be hardened, can cholesterol also cause that?
For the muscle of the heart to become hardened.
Yes.
I never said the muscle of the heart becomes hardened though.
Yes. No, I am saying you are not saying that. I am.
Okay. You are saying that. Oh, okay.
Yes, I am saying, can it cause that?
No. Cholesterol, the role of cholesterol. No, it's not about that. Hardened muscle of the heart there.
Okay.
Sometimes there are multiple causes to it. Okay.
Okay, thank you, sir.
It can in a way. What will happen is that when we talk about hardened muscle, we are talking about fibrosis of the lung of the heart too, leading to infarction, leading to necrosis of the heart. Is that what you're talking about? Is that what you mean?
Yes.
No, for that one, yes. When there is a blockage, when there is an impairment in blood supply. For instance, look at my screen. Can you see my screen?
Yes, sir.
Can you see?
Yes, sir.
You can see my screen, right? Okay, so look at this. Have a look at this. This is atherosclerosis. Okay, this is an atheroma. This is what? These are fat deposits. And what are they doing? They are blocking the blood vessel. Look at it. This is a blood vessel. So imagine the blood vessel has been lined with fats like this. Have you seen this very one? You see this is a clear one.
Yes, sir.
This is a clear one. And this one is what? It's lined by what? By these plates. It can cause a blockage. Look at this very one. You see fat deposits all around. So if this one is happening if this one is happening in the brain, what do you think can cause? We'll get there. We'll get to stroke. Evans, are you there?
Yes, please, I'm here.
On our stroke lecture, Evans, you lecture us on our stroke lecture.
Thank you, sir.
Mr. Komisoku, you are also here. I've caught you. You are also here. Mr. Komisoku, I just saw your thumbs up. I'll be calling you on our stroke lecture. You guys you are masters of stroke. Charlotte, Bokowi, you are here. So you see, that's good. That's my people. So you see, these are what? These are blood vessels in there. Sorry, there are fat deposits in there, and lipids can cause that. Lipid build up in the blood vessels is causing that. So it's going to what? They are going to. It's going to what? It's going to block the blood vessel, the blood from what? Transporting very well. Do you see it? Look at
yes,
it.
sir.
You see this one? The blood can the blood can what? Can just clodge over here. They can just clodge over there. So that is what? Atherosclerosis. This is atherosclerosis. Because this is atherosclerosis. What you see here is what is an atheroma. So fat, this is what lipids can cause. So if this one is occurring at the veins of the heart, it can cause a heart attack. So atherosclerosis can actually cause heart attack. Okay, that is what they can cause. They can actually cause a heart attack. So if somebody comes to your consulting room and the person, you go to do a lipid profile for the person is having high BPs. You do a lipid profile okay, Mr. Philip, I'll answer you. You do a lipid profile and the lipid is high.
Okay, done.
It should make you know that what? It should make you know that there is what? There are plaques in the blood vessel. There's some atheroma somewhere that is causing that. You understand? Look at this one. You see this one? A normal blood vessel. Clear. and now partly blocked blood vessel. So if there is pressure here and the blood is moving helter-skelter in the blood vessels, can't they come and lock up over here? When it locks up, what will happen? For instance, it's like a gutter. It's like a gutter in Ghana. Ghana, our gutters are blocked. Most of our gutters are blocked. So it's like this is like a gutter in Ghana. So it's going to cause choking. And when it chokes up, what will happen? Or when there is choking, there's flooding, a lot of chaos occur. So if this thing happens, it's going to cause a lot of problems. You understand? All the flooding that is occurring in the world, in Ghana, it's because there is what? Our gutters are all choked up. So the waterways are blocked. So if your blood vessels are blocked, and there's going to be a problem. I think we understand now.
Yes, sir.
All right.
So, Doc.
The last question. And yes.
Doc.
Yes.
Please. So when it happens like that, what will you do?
So I have a question.
Okay, so like I said, so now you as a naturopathist, now you know that you should be able to know about drugs that help with what? With cholesterol. That helps to burn fats.
Okay.
So you as a naturopathist, you are not going to give a general drug. You're going to give drugs that will help to burn fats so that the blood will circulate fine.
Okay.
Because now you have gone to do the lipid profile, and you have seen that all the cholesterols are high. So it is making you picture the person's blood vessel from this picture. You have to picture the person's blood vessel that maybe the blood vessels are blocked. So what do I do? Let me give some medicine that will help burn the fats, so that the blood can move freely. Do you understand? So this is what you have in mind from what you have learned today. That is what should be in your mind, that you are giving blood you are giving medicine that will help to burn the fats. And the same as the orthodox drugs that we give, the atorvastatin we give, what is it doing? It is helping to what? To burn the fats. It's helping to block the fat channel so that the fats cannot be piling up in the blood vessel for it to block. For the blockage there, we cannot do anything about it. But we can give medicine that would help to what? To make the fats melt up. Do you understand?
So exercise to help?
My brother, that is the best. That is where you will start from.
Okay.
If someone is saying niacin is very good for it. So your first thing is you're going to what? You are going to start non-pharmacological. So exercising is very one. Exercise burn. So anything that you can do to burn fat.
Okay.
You understand? But then the reason why I did not mention exercise first is because of the fact that this person has come to you with very high BPs. So there are situations where you tell the patient to go and do exercise, and there are situations where you have to give blood, you have to give medicine. The patient comes to you at a very critical condition, at a critical stage, at a very deadly stage, having other comorbid conditions for which the patient cannot do exercise. Don't still say patient go and do exercise. Give the person medicine to go and help. Because the time that the person has to do exercise has passed. That is one thing that most of our herbal doctors do. But now
because
you are learning, so you know.
Doc, the reason why I asked is that there was a friend of mine who was having similar situation.
Okay.
So he went to church and his pastor told him to fast 21 days. And according to my friend, said that when he did the 21 days, he was just drinking water. He went back to the hospital. Doctor said all the cholesterol and everything is gone.
Okay.
So that's why I just asked you all these questions.
So it's good. If you can fast, it's good.
Hello,
but then
sir.
fasting is not for. Hello.
Yeah, I'm sorry for barging. I'm currently driving. I wanted to ask something that, as a naturopath, if you are asked how does exercising contribute to cholesterol depletion? How are you going to answer the person?
So by simple, so exercise helps to burn fats. As simple as that. Exercise
Okay.
helps to burn fats. The fat is there, like the food you have eaten. They tend to go and lie in there. But when you exercise, the reason how do these fats occur? For instance, after eating, most of us live sedentary lives. After eating, there's no digestion. Fat metabolism, protein metabolism, carbohydrate metabolism, they are all taking place. And what happens is that most of us, when we eat, we go and sleep. We live sedentary life. So digestion or metabolism does not occur very well. So it means that most of these fats and those things are not able to undergo proper metabolism for them to what? For them to be stored in the adipose tissue. They tend to find themselves lying in the blood vessels. So when you exercise,
can I come in?
I'm coming. I'll finish right now. So when you exercise, what you do is that you tend to help in what? In these metabolic activities and also burn of fats. Okay. So you can add up. Yes, you can come in.
Okay, sir. Good evening.
Good evening, madam.
This topic is very, very important. And I am a case study. 2 years ago, I had this problem. Fortunately, when I went to a church, when our church conducted a screening and my BP was so 400, I was to stop oil. So when I stopped taking oil, I think it helps me, and I only go with olive oil. Coconut oil is not good for me even as of now. Anything fried. So as a naturopath, when we have these cases, I think we should advise our patients to stop oil based on the level of the cholesterol. So for 2-3 days now, I don't take oil. Either I go to I take fish oil or olive oil, and anytime I take fried, I will have that heart attack. So I know this one. You try and give us a picture of the heart that is beating.
A picture of what?
The heart. The heart that is pumping.
I can't hear you.
Hello.
Yes,
Your line is breaking, so you must
Doc,
position
can I
yourself.
ask a question now?
No, she's on the floor. She's on the floor.
Our next class, let's try and demonstrate or give us a picture of live heart beating, pumping, so that at least today's lesson on heart, we are so happy. As you're explaining the heart, the functions of the heart, then if the live pumping heart is there, I think it's to add to what you're doing. Thank you, sir.
Okay, that's well noted. You want to see a heart that is pumping, a live heart pumping. Okay, that's fine. We'll use Zuzu's own for you. Don't worry. We'll open Zuzu's heart and see how it's pumping for you. Let's have. Who was coming to talk?
I am next. Thank you. My question is similar, in line with that. Not that I want to see a live heart, but I would want to know what would be some of the screening tests that we can do to identify these conditions. But if we want to, the person come with us to us breathless, how do we start the process of diagnosing what the condition is?
Okay.
Thank you.
Okay, so that's fine. So first, when a patient comes to you, you would want to look at check the BP, because right now we have got to know that cardiovascular conditions want to look at the BP, there's another slide that I'll have to show you. I'll have to teach you another slide, okay? So I think we have understood this part. We have understood to this part. Okay, so let me use that slide to explain certain things to you. Maybe you see how the heart is pumping over there. Let me use another slide.
Oh, please, my question
So
is.
you hold on with your question, the one you asked right now. Hold on with it. I'll answer you, okay? Keep it in mind. Don't forget. Yes, who is talking? Is it Mr. Diodu?
Yes, sir.
Who wants to talk? Someone is saying he wants to talk. Okay, let me see.
I don't know what am I in the queue? I just wanted to say that that blockage, there are natural remedies that can be had for that, and different things. I had a friend who was scheduled for an operation for her cholesterol because of the same blockages, she said, the doctor said. And I told her not to stop the schedule, but to do what I posted in the comments. And when she went for the pre-operation examination to go ahead to do the operation, she didn't have a problem. So it's similar to like going to the church and fasting, because in fasting, there are things that happen in the body that could clear those blockages. But there are other natural remedies that can be applied to that. That's what I wanted to say. Thank you.
All right, that's fine. Thank you for any question? Mr.
Yes, I have a question, sir.
Is it Mr. William?
Davis.
Good evening. Let's hear you.
William.
Yeah,
please.
let's
My
hear you,
question
Mr.
has
William.
to do. Yeah, my question has to do with CVI, chronic venous insufficiency,
Okay.
and how it affects the heart. I haven't known much about CVI, but I have a patient who presents with this, and usually he complains of serious fibrillation and palpitation, and he describes this as that his whole body is going through a football match. His whole being is in a state of like playing a football match,
Okay.
full of chaos and full of noise. So I want to understand the ramifications on the heart and how to resolve it, if you can help me with that.
Okay. It will all boil down to the heart being failing. Okay. Now, sometimes okay. We'll end it. I think this should be the last question so far. Looks like the questions are plenty. I want us to read another one. Yeah, so when we talk about the insufficiency, what does the veins do? The veins do what? They are the ones feeding the heart. Okay, they are like the scrap dealers to the heart. Sometimes there can be conditions and situations in the body, like this atherosclerosis and plaques all over. It's affecting the heart. So there's no proper return, and so the heart is not able to pump enough. I don't know if you get what I'm saying. So at every point in time, there's a deficit somewhere. Because there's a blockage, there's a condition, there's a problem, there's some weakness of some vessels, and so enough is not able to come to the blood. It's not able to come to the heart. If the enough is not coming, the heart will not be able to pump a lot, and all these ones come into play. But I think we'll have to delve more into it so that we know the correct pathophysiology for that. I mean, we'll delve more into the pathophysiology for venous insufficiency. I wanted to give you another slide so that we explain certain things you are asking. You can find them in the next slide. I'm coming. Let me see. B.
Okay, thank you very much.
You're welcome, sir. So somebody wants to see how the heart is functioning. Can you see?
Yes, sir. Yes, please.
So have a look at it critically. What do you see? I can't see your this. What I'm sharing is, can you see that the heart is moving, the blood is filling and moving?
Sir.
Is
Yes,
that what you
please.
see? Is that what you are seeing?
Yes, sir.
Yes.
I'm saying that when I put it on show, I'm not able to see whether I've shared it. So
Sir, please, we can see.
Okay. So you see, this is what she wanted to see, right? Someone asked this question.
Yes, please.
Are you okay now? Look at it. This is how the heart works.
Yes.
So you see, the blood came from what? From the veins. The one down is those are the major veins. The inferior vena cava and the superior vena cava. The inferior is the one coming from the down, the superior is the one coming from the top, from the brain and the other vessels of the heart. So we are saying that this is the what? From the veins, they enter the what? The right atrium. Then the right atrium, the valve open. Then as the right ventricle fills up, it moves to the what? To the pulmonary. When it goes to the pulmonary, it is coming back into the what? The right atrium. Another one is coming back into the right atrium. Then the what? The left atrium. Then the left ventricle will fill up. You see, it's filling up. As it fills up, then you see that the aorta is reddening up. So as it's filling, then it's pushing it away. Do you see it now?
It is happening.
So our sister who wanted to see how the heart functions, this is it.
Doc, thank you, sir. Thank you, sir.
So now, do you understand now? So just take a critical look at it. You would appreciate it. When I give you the slide, put it on show, on this one, on projector show. You see how it's moving. So nice. And this one is occurring at microseconds. So. So now let's look at we are looking at the what? Characteristics of the cardiac muscle. The contraction of cardiac muscle is dependent on the amount of extracellular calcium in the muscle. When we say calcium, calcium helps, is a mineral or is an element or is a, how do you call it? Is it an element? Yes, it's an element.
It's an element.
More like it has charges. It helps with what? With the contractility, muscle contractility. Okay, it's a calcium that helps the muscles to contract. That's why we have a condition, a drug we call, a class of drug we call calcium channel blockers. So what does the calcium do? Calcium helps, it's an electrolyte that helps what? That helps the heart to contract. So the contraction of the heart muscle is dependent on the movement of extracellular calcium into the muscle. So the amount of muscle that is being pumped into the heart muscle is what I'm talking about. Helps with the contractility. Calcium-induced calcium release. So there is an induction of the calcium, then it's being released. Calcium muscle is unable to generate tetanic contractions. So very long refractory period, cardiac activity is cyclic. When we say tetanic contractions, tetanus, someone who has tetanus, calcium muscles are not able to generate contractions in them because they have a very long refractory period. That one is in tetanus. If you have seen someone who has tetanus before, they have their body loose locked up. They become very stiff. So calcium channels cannot work in that. This one is the process by which the calcium, the contractility occurs. Action potential, opening of L type. This is more of chemical reactions. I want us to look at this one. The cardiac cycle. So division. The cardiac events. Now the cardiac cycle is what I showed to you. There's a cardiac cycle. What you saw happening. That's the cardiac cycle. Venous blood coming to the right atrium, from the right atrium to the right ventricle, from the right ventricle to the pulmonary artery back to the left atrium, to the left ventricle, to the aorta, to all parts of the body. That is the cardiac cycle. Okay, so the cardiac cycle events that occur from the beginning of the heartbeat to the beginning of the next are called the cardiac cycle. So there are two types. There are two of the heartbeats. We have the what? Systolic heartbeat, and we have the diastolic heartbeat. Please follow. Don't pay attention here. We have two. Cardiac cycle is composed of two periods. We have the systolic and the diastolic. When we say systolic, we are talking about what? When the heart is what? Pumping. Okay, when the heart is what? When the heart is what? Is pumping. Or when the heart is contracting. That is a systolic. The heart, when it contracts, what does it do? It contracts to pump. And when it's relaxed, what does it do? It relaxes to receive. Okay? It will contract to pump. And it will relax to receive. So, this is how it is. The blood, so I would say that the relaxation part of the heart occurs at the aorta, at the atriums, at both atriums. Now the contraction part of the heart occurs at where? At the ventricles. Do you believe that?
Yes.
The relaxing part, no, the contraction part of the heart. Sorry, let's take the relaxing. When the heart is relaxing, it occurs at the what? At the aortas. Sorry, the atriums. The atriums. Now, when it's contracting, it contracts at the what? At the ventricles. So the ventricles contract, the aortas what? Relax. Okay. So we are saying that systole, period of what? Ventricular or atrial contraction. So the systolic heartbeat, that is the first one. Let me say, when you say someone's BP is what? 120/80. The 120 you see is the systolic. At that point, the heart is what? Contracting. It is pumping, it is contracting to pump blood. And at that time, contraction occurs for the blood to leave the heart. So it's either the blood is leaving the heart to the lungs, or is leaving the heart to all parts of the body. So when the blood is leaving the heart to the lungs, which part is contracting? Yes, Messi. And I'm Eunice.
Just a minute. I don't know. You just interchanged something. Or maybe I didn't hear you right. You just made mention that the circulation of the blood from the atrial,
The right side.
it's relaxes and the ventricles contract. But you just said aorta.
Oh no, it was a mistake. I said,
It's rather relaxes in the aorta. So I don't know if this was a mistake or something.
I'm saying that is a mistake. I actually corrected myself. I'm talking about the atrium. The atrium.
Okay.
Yes, those are the atriums are the relaxing part.
Okay, exactly. All right. Thank you.
Okay.
Exactly. Okay. All right.
Because I want to explain it for you to understand. So, even with the relaxation part, it occurs in all the areas. The contraction part occurs in all the areas. Let me put it this way. But then the majority one, most of the time, our focus is at the left ventricle. Okay, most of the time our focus is at the left, because that is where a lot pumping occurs. But if you are looking at the thing very well, you realize that the relaxation occurs in all the areas, and the contraction occurs in all the areas. Ask me why. Now, when the blood follow suit. When the blood gets to the right atrium, let me use a picture for you to understand. When the blood gets here, it will contract. When the pressure is up, it will contract to bring the blood here. It will contract. So there's going to be a pressure here. It will contract to bring it here. It will as well, this one also contract to bring the blood here. And as it's coming here, this one is what? It's relaxed to receive. They are all relaxed. They are receiving. So when the blood is filling up, it is relaxed. Let me put it that way. Let me correct it that way. I wanted to explain it in a way for you to understand. When the heart is filling up, it is relaxed. And then when it's pumping, it is contracting. It contracts to pump. You understand? So it's either right atrium is pumping down into the right ventricle, or the right ventricle is pumping up into the pulmonary artery, or the left ventricle is pumping, the left atrium is pumping down into the left ventricle, or the left ventricle is pumping up into the aorta. You understand? So the contraction part is the systolic, and the relaxing part is the what? Is the diastolic. So we are saying that period of ventricular or atrial contraction. That is why we are saying. So we don't say only the ventricles contract. No, I wanted to explain that, but that is not the right thing. So systole is period of ventricular or atrial contraction. So the contraction occurs in all the four regions of the heart. So it's either one is contracting to release into another, or contracting to pump away. Then when we come to the diastole, it's a period of ventricular or atrial relaxation. And what happens? In simple terms, we are saying that systole is when the heart is what? Is contracting. And diastole is when the heart is what? Is relaxing to receive the blood before it will pump. Do you understand now?
Yes.
So the duration of the cardiac cycle is what? 0.8 seconds at a heart rate of what? 75 beats per minute. That is the average. That is when we are talking about this is average. Average, the cardiac cycle takes 8 seconds. 0. It's not 8 seconds, 0.8. It's not up to 1 second. It's not up to 1 second. 0.8 seconds. So the cat that you're talking about, the next cannot, it has happened already. You understand? It's not up to 1 second. So 0.8 seconds at a heart rate of what? 75 beats per minute. Average. This is averagely. So that is a cardiac cycle for you. Very important. Property of cardiac cycle. Each chamber has its own cardiac cycle. So you see, each chamber has its own cardiac cycle. So the ventricles. So when we look at the ventricles, 0.3 seconds for systole and 0.5 seconds for diastole. What does this mean? So let's take the left ventricle as an example. We are saying that when the left ventricle is pumping, it's contracting, it takes what? 3 seconds, 0.3 seconds to contract. And when it's what? When it's filling up or when it's relaxed, it takes what? 0.5 seconds to relax. That's for the ventricles. Then for the atria, 0.1 second to what? To contract, means that it doesn't contract a lot. It contracts small amount of contraction because that place there is just living there to another for the atria. It takes a very short period for the atria to what? To contract. Then when it's relaxed, that's when it's failing to accept. When it's receiving blood, when it's receiving this one, the blood, it does what? It takes 0.7 seconds. Atria contract before ventricles. We know that already. The atrium contract before the ventricles. Like you saw over here. You see that the atrium will contract. It will contract and push the blood into the what? Into the ventricles. Two sides of atria and ventricles contract at the same time. So this thing is occurring at the same time. They are all occurring at the same time because the blood that goes in is going, another one is coming. So there's nothing like an end. It's not like it's not like if 2 mils is pumping now, the body is waiting for that 2 mils to go to the lungs to go and pick oxygen before it will come back for you to pump it. And it will be waiting for that same 2 mils. No. The one that is going, another one is coming and it's going. And it's in a cycle. That's why I say cardiac cycle. So it's not like the 2 mils that is being pumped within this second. It's that same 2 mils that we are waiting for it to. But the 2 mils that is pumped within this seconds into the lungs, we are waiting for that same 2 mils so that we can pump it to the heart, to all parts of the body. No, there's another 2 mils. That's another mil blood that is coming. So that is going to be pumped before the one that was pumped right now. Diastole is it's longer than systole. I think that the diastole is what? It's longer than the systole. Why? The heart takes time to fill up. So you can see that all the diastoles are longer. That is when the heart is relaxing. So that is why it becomes a problem or becomes a big issue when your diastolic is high. When your systolic is high, it's not normal, but that is how it's supposed to be. I mean, when it goes beyond 148, then we know that it's high. But then let's say the systolic is, let's say you are hypertensive and your diastolic is around 150. It becomes a problem for us to worry about, because your diastolic should be relaxed, and in your relaxed state you are beyond you are going beyond, even beyond systolic, so it becomes a problem. So we are saying that what diastole is longer than systole. Why? The higher the heart rate, a higher heart rate leads to diastolic going down, then systolic also going down.
Very good.
3 minutes. Oh, sorry. It's time for the next class, eh?
Yeah, it's time for the next class.
I'm tired.
Let's the class. I'm tired.
Yeah, so I think we'll end it here so that you join your next class.
Thank you.
Yeah. Your questions are welcome for the next class, man. I'll be leaving the 2 slides with you. You look through them. The questions are welcome. If there's anything you don't understand, you just write it down. When we meet in our next class, some of the slides, don't worry, we are not going to study you. We'll just go through some of them. Those that this one, I'll not worry with it.
Thank you, Doc.
Thank you.
All right. Bye-bye.
Thank you. Have a good
evening. Bye.
I'm sure you have learned something. Don't forget to.
Yes, we have.
Yeah.
Thank you.